So welcome to the Wokingham Wellbeing Board. David is on holiday, so you've got me chairing today. Slight apologies, I haven't done a hybrid meeting before, so it'll be quite an interesting meeting, I'm sure. So we have a number of apologies. Obviously, David. What other apologies?
Nick Fellows and Steve Moore and Sarah Deason.
Thank you. I'd like to welcome Sarah Webster, who's our place-based member for the ICB. Sarah, are you happy for everybody to introduce themselves as they speak, or do you want to go round? That's fine. Okay, we'll do that. Thank you very much. So going through to the minutes of the previous meeting, which are pages 7 to 10, did anybody have any issues or recommendations? Can't see anything in the room, nothing online. So thank you very much. Any new declarations of interest? Again, can't see anything in the room or online. Thank you. I haven't been made aware of any public questions. Are there any member questions? No? Thank you very much. So we'll go straight ahead to the ICB and ICP update, and over to you, Sarah. Thank you.
Hi, thank you very much. Hello, everybody. So as Debbie said, I'm Sarah Webster, Executive Director for Berkshire West ICB, and delighted to be here. This is week 2, so still in learning phase and looking forward to meeting as many of you as possible over the coming weeks. So I'll take the slides that were submitted as read, but I will give a couple of concise updates over the top as things have continued to progress since the papers were submitted. So first of all, the ICB, the Integrated Care Board, which is the new NHS statutory body that replaced CCGs, met at the end of September and received papers that are available online on a range of areas, including the Integrated Care Partnership formation, which is the partnership of NHS and local authority bodies within the Berkshire, Oxfordshire and Buckinghamshire geography. The integrated care strategy development and the working with people and community strategy. So just to touch on the partnership formation. So the statutory members of the integrated care partnership, being the ICB plus the 5 local authorities, have now agreed the wider membership of the partnership and will have its first meeting on the 27th of October, so slightly later in the month than had originally been anticipated. Locally, we also now need to work to develop our own place-based partnership for Berkshire West, with the aim being to devolve as much local decision-making as possible from the ICPB to this local partnership. This absolutely needs to be jointly developed. So it's a joint initiative between health and care and local authorities and anyone involved locally. So we'll be working alongside colleagues at Wokingham Local Authority, as well as Reading and West Berkshire as this develops over the coming months. And input and views will be sought from this committee as things progress. And just to reassure, this is going to be an iterative process. So it's something that's going to take us collectively a while to land exactly what we want place to look like. But I'm excited about where that could go and what that could do to improve things locally for our population. A quick note on the strategy development. So as you'll see from the slides, the partnership needs to agree a joint strategy by the end of this year, which is based on nationally set timescales. Those deadlines are extremely tight. So a number of working groups have been working together to identify themes and issues that would benefit from real collaboration between the partnership members, with the aim being to work together to get better outcomes for the people we serve. It's expected that this version of the strategy will largely be based on common themes from the current health and wellbeing strategies that are excellent documents, and ultimately will be signed off by the partnership in December. So there's an ongoing period of engagement, and there's a meeting on Monday with the chairs of the health and wellbeing boards to start exploring emerging themes and confirm how best to engage with broader health and wellbeing members during November as things progress. I'm very conscious that we don't have a meeting sitting in November, so if there's any other suggestions or thoughts on how best to engage with this committee as that progresses, I'd very much like to know. And I do know a number of people who are involved in this meeting today are very engaged and involved in those working groups developing the strategy, so we'll know an awful lot about that as well. And then finally, just to note a couple of leadership changes that you will be aware of, but worth noting is it's an update to the papers. So as you'll know, James Kent has stepped down from the role of ICB Chief Executive to take on a national role. In the very short term, Rachel Decow, our Chief Medical Officer, is acting up into the Chief Executive Officer role. And very shortly, Steve McManus, who's currently the Chief Executive at the Royal Berkshire Foundation Trust, will be joining us as interim CEO at the end of this month. So just to note that as well, because that's different to the information in the slides, and we're looking forward to welcoming Steve into this new role. So I will pause there, very happy to take any questions at all. And as I say, I'm looking forward to meeting you all as I settle into this new role.
Thank you, Sarah. Any questions?
Thank you. My name's Councillor Charles Margate. Wanted to ask, firstly, welcome to your new role. Now, you may be aware, you may not be aware, but this Wellbeing Board's been expressing concern over the NHS reforms for about a year. Obviously, nothing to do with you. Basically, I should make that absolutely clear. Particular concerns were how remote some of this was, basically how distant it was. We're very different from Oxfordshire and Buckinghamshire with different challenges. Also, the three Berkshire authorities, West Berkshire, Reading and us, are all quite different as well and have different needs. And, you know, we had your predecessor, well, not your predecessor, sorry, Dr. Kent here a couple of times and made this very clear to him. Now, I actually wrote to him when I was chair of this body back in February on behalf of the council. We never received a response. And it was really just to ask that, you know, over the next few weeks, as you get involved basically in this and get to grips with everything that's going on, that you could really try and have a look at our concerns and address them with all the relevant people.
Absolutely. So first of all, I just want to re-emphasise my commitment to all working on this together. We're all here to serve our people and make sure that everyone is staying well and getting the best value for money out of the money that we have to serve our populations. And I don't want this to feel like it's coming from any particular angle or with an agenda in mind from any particular organisation. We're working together on this, and one way to make sure that we don't lose a sense of locality it's within our gift as we're designing what our place-based partnership looks like, to try and make sure that we bring everything back as local as possible. We don't want to just have everything held centrally. That's not the intention of the ICP. That's not the intention of the ICB. And as we progress the development of place-based partnerships, I absolutely want to make sure your concerns are in mind and addressed, and that this is something we work on together. So yes, I'll commit to coming back to you, and it would be, if it's helpful for us to meet individually as well to explore those, I'd be very happy to offer my time for that too.
Matt?
Sorry, I am here. Thank you, Sarah. So just on that theme, I suppose, but on a more practical note, one of the issues we've had going forward is, with a big footprint, complicated footprint like Bob, there is an enormous amount of meetings that are going on, and we don't have, it's very difficult to have, from a local authority point of view, to have a view of what those meetings are so we can make sure we're engaging in the right one. We've never been able to kind of get that. So, for instance, in that conversation, it is a complete surprise to me that David's going to a meeting of wellbeing chairs on Monday. I didn't know that. Normally, if we did, we could plan and make sure everyone's well briefed and engaging in that. So that's something I think that needs to be solved. Another issue is, I suppose, around the strategy. We really want that alignment between the Wellbeing Board strategy and the ICP strategy, and a read across and buy-in. But before the ICP strategy gets signed off, how will it come back in its totality here, so that could be considered? Because that seems a bit tricky, because even though I'm quite involved in it, I'm only involved in a part of it. You don't see it all come together. You know, there are lots of different work streams and meetings. So it's just how we manage to do that, I suppose, given the timescales.
Okay, thanks, Matt. So on the first point around the committees, I agree with you. At the moment, there are a lot, and the structure needs some clarification. So as we work together on this, and first we'll start firming up place, but also the arrangements at ICB and ICP become clearer and more embedded. I'd hope that would be able, there's the opportunity for us to be able to give some clarity on what's going where and streamline it as far as possible, because nobody wants to spend all of their life in committees when we could be doing things that are more constructive. In terms of how the strategy can be further considered here, I think I'd love to hear suggestions and preferences of how we do that, whether it's through an extraordinary single agenda point or if it's outside of a formal committee structure. I'm keen to ensure we engage as much as possible. So if there are any suggestions and preferences, please let me know, and hopefully this can also be discussed on Monday at the chairs meeting.
Yeah, I suppose as a quick reaction to that, I can't speak for the rest of the board, but we meet every month, either a public meeting like this or an informal meeting. We could easily repurpose one of those dates going forward as a suggestion.
Helen, sorry, out of order. Sorry, Helen.
Thank you, Chair. Sarah, lovely to meet you and welcome. I'm going to come from a children's perspective here, and you know, I've read the slides and I welcome the fact that there is a Start Well group. I'm not actually engaged in it as a DCS. And obviously, you know, I'm happy to make further inquiries about that and to speak with Kevin about that, who's I know is the Oxfordshire DCS. But I suppose we are particularly challenged in Wokingham at the moment around children with special educational needs and the demand that we have there. And I'm very interested as to where that particularly plays out in terms of the whole arrangements and the strategic approach here, and wondering whether there's more that can be said on that. And happy to meet with you outside of the meeting if that's helpful to discuss further, but would be interested in your initial response. Thank you.
Thank you, Helen. So absolutely, I'd love to meet outside of the meeting as well. I think it's something that's absolutely being considered as part of the strategy, and if you or want to be a bit more involved in that, that's absolutely fine. Or I don't know if other colleagues in the room who have been more closely involved in those work streams might want to comment. But also just coming back to the conversation around place-based partnership development, and there is definitely a desire to keep this particular area of sort of children's mental health and well-being as local as possible, and being one of the areas that as a place-based partnership we might want to take a strong local lead on, with sort of as much delegation around that as possible locally, because it has to be, it is of clear importance as well. So I think that's something that will be considered too strong, both in the strategy but also as we develop place-based partnerships going forwards.
Thank you.
Great. Thank you. So I'm Prue Bray, I'm councillor, I'm the lead member for Children's Services. So part of what I was going to say has been addressed by Helen, that's good. We're singing from the same hymn sheet. But the other bit I want to say, I know it's early days for all of this, it's only really formed in July, but it does feel a bit done to and not done with. So I'm welcoming your choices of words like partnership and things like that, and us being able to engage with it. We don't feel engaged. I hope that's to do with setting up and it all being a bit difficult, but we are small in comparison to the size of the rest of the thing, and it is worrying me somewhat that we will continue to be done to by bigger bodies and not have our needs understood enough within that. So it's not I'm not shouting at you. I'm pleading for a more partnership-based approach, which actually isn't. So I'm hearing the right words. I just want to see it happen. And the only other thing I would say is that yes, you're engaging with the Wellbeing Board. We also have in local authorities the Health Overview and Scrutiny Committees. And I'm just wondering what their role is in any of this. Are they able to call any of you to come to a meeting and explain what's going on? And would you welcome that opportunity?
Yes, so on the second point first, absolutely. Happy to, keen to attend wherever would be helpful. So yes, I'd be delighted to come along to the Health Overview and Scrutiny Committee along with colleagues as well, if that would be helpful to provide a good overview of where we are and get the right engagement there. In terms of your first point around partnership working, I appreciate the feedback. Thank you very much for being open about that. I really do hope that this feels like a partnership moving forwards. And I would say that if you feel like the voices of Wokingham isn't being heard, that would be partly a personal failing on my part as well. So I'd want to hope that going forwards that we do feel like it's a true collaboration as opposed to anything else.
Susan.
Thank you very much. I am Susan Parsons, the Chief Executive of the Council. Hi. So something I wanted to raise, Sarah, was regards to a paper that's either very recently gone or going to the ICB, which is the place-based paper. And it's just to raise that, and I'm sure you know, and I know it's not to do with you, but that's a paper about place-based working, and none of the local authorities were involved in the development of that paper. So, and it's something we've raised when James Kent was here. So I suppose it's a flag really just to raise with you that it didn't set the right tone really in terms of ensuring that it is proper co-production. And I know you did mention at the start that there will be an iteration, but I think the problem is that if it starts on a particular foot, it doesn't help as we move forward.
So again, thank you for your open and honest feedback about that. That paper can be used as a discussion point going forwards as we locally start to describe what we want our place-based partnership to look like. It wasn't intended to be a prescription as to what it's going to be. So I just wanted to provide that reassurance. And it is within our gift place to come together to describe what we want our place-based partnership to look like, how we want to transition there. Obviously, it's going to be step by step and not a big bang approach, and doing that absolutely together.
Okay, thank you. And in terms of the strategy, a concern I've got around the strategy is that they are big. There's a lot of people involved around in the strategy, in the different chapters, as it were, for the strategy, and it is ensuring that there's enough time for members of this board to actually properly see, the overall sort of strategy and feed into it. So it's just again a flag. I know Matt's talked about how we might actually utilise time here, but it's ensuring that there is enough time to properly feed into the process, but see it in its totality.
Absolutely. I'll take that point away to my colleagues in strategy to make sure that we get the timings right around sharing and then asking for feedback.
Thank you.
Tracy.
Thank you. Nice to see you again, Sarah. I feel like I've stalked you today, been on several meetings together, but a very warm welcome. Mine's more of an offer, really. I am one of the chapter authors, or one of the Strand facilitators, I should say. And one of the things that is coming through quite strongly is that the approach automatically takes us into quite a clinical space, a very technical space. And it's how we broaden that out to make it more population focused, and how we focus that more on the outcomes and the desire that we want to get to in terms of representing the health of our populations. And I think there's something about that will help us, because Susan's just raised part of my point in terms of how we align this to the work of the local authorities, in particular the ambitions of the health and wellbeing boards, and make sure that there's no crossover, but there's absolutely a touch point where those documents will complement each other, so we can deliver some commonality around those priorities. And I think the time point's well made in terms of how we've got enough time to articulate and design these while getting that co-production in place, but making sure that we can bring it to forums such as this, where our statutory partners sit, and voluntary partners, so that we can get the views of all and embed it. So it's partly an offer and a plea that we have a public health approach to this, because obviously having that evidence and that needs base is crucial, but also making sure that we have that opportunity to make sure that all of our partners are engaged in that process.
Okay, thank you.
So yeah, thank you, Sarah, and welcome. I know it's only week 2 for you starting in the role, and I think all eyes are on you to make this work. I've been in a few meetings with Sarah recently, and had those conversations about actually how we're quite mature in Wokingham, and we have got those conversations in different groups where we do talk openly with each other, being critical friends to different providers. So Sarah's well abreast of what's worked well, what doesn't work so well, and that we are kind of a piece of rock with Wokingham all the way through it, and we will keep banging that Wokingham drum. So welcome and good luck with your huge umbrella that you have to provide. So thank you, Sarah.
Thank you.
Joe, would you like to give us an update on all things COVID vaccination?
Yeah, absolutely. Thank you, Debbie. So for those who don't know me, my name is Jo Reeves. I'm the Newbury Locality Manager for the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board. Alongside my counterparts for Reading and Wokingham, we've prepared the document which is in your packs, which pulls together the strands of the COVID vaccination programme for the autumn. The plan's been adopted by the Berkshire West Vaccine Action Group, and I've also presented this plan to Wokingham's Health Overview and Scrutiny Committee in late September. I don't intend to go through page by page, as it has been provided in the pack for you, and I appreciate you have a full agenda, so I'll just provide a summary and key updates, and happy to take any questions. So there are 2 strands to the COVID vaccination programme this autumn. There's maintaining an evergreen offer of primary vaccination course, and there's delivering the autumn booster to the cohorts identified by the Joint Committee on Vaccination and Immunisation. The autumn booster programme commenced on the 5th of September and initially focused on the most vulnerable cohorts. However, this week the programme's been extended to all patient cohorts, so everybody eligible for their autumn booster has now been called forward. Jabs are available at the Broad Street Mall in Reading, community pharmacies in the Wokingham district, PCNs and at Wokingham Civic Centre. Access is via the National Booking System on the NHS website or calling 111, or by direct invitation from GPs. PCNs are also visiting care home residents and housebound patients. There is a target of the end of October for all care home residents to be visited, and we seem to be on track to meet that target. The NHS has been sending text messages and letters to invite people to book their appointment. A national communications campaign will be launching imminently to encourage as many people as possible to top up their immunity for winter for both their flu and COVID vaccinations. And in fact, where possible, PCNs and pharmacies are co-administering the COVID and flu vaccines at the same time. In terms of the evergreen or the primary course, that's available at the Broad Street Mall Mass Vaccination Centre, and to bring it more locally in Wokingham is a key focus of our inequalities approach, and we'll be using the Health on the Move service as we have in previous rounds of the vaccination programme. So we're working closely with colleagues in the council to roll out that service, and we'll work with the comms team to promote the schedule once that's developed. So that's all I wanted to cover, just a overview really, but really happy to take any questions.
Charles.
Thank you. I've read the document. I welcome the commitment to keep the Wokingham Vaccination Centre going. something, Broad Street Mall is a long way from here, basically, especially at busy times. I think that's really important to ensure vaccination. My question was actually regarding something else, which was my understanding is healthcare staff can be vaccinated at work, yet social care staff have to book in the national system. This is an area where people are, there's big job shortages. These are not well-paid people. Having to take half a day off to go for a vaccination is not particularly good, and also causes problems in the work area, and I'm sure has an effect on uptake. So I wondered if you'd have a look at that, basically, and would welcome your comments on it.
Yeah, very happy to take that away and see if there's something we can do. I think understanding the picture in social care, although there is sometimes a concentration of staff in particular settings, often staff are dispersed among various providers, which means that can be a challenge, and that's why staff are called to use the national booking system to book an appointment sort of around their shifts. But I do appreciate the complexity there, but very happy to go away and see if there are any mechanisms that could be deployed to support where there are concentrations of social care staff in one place.
Sarah.
Just to come in on that as well, to reassure, this is something that I raised with our Chief Nursing Officer just yesterday to see if we can get clarity and confirmation around the equitable access. So we'll be able to come back to you on that as soon as possible.
Thank you.
Matt.
Hi, Joe. I just wanted to circle back to care home residents. I'm assuming by that you mean older people's care homes only, or do you mean learning disability care homes as well? Because older people's care homes are only half the care homes in the borough, although more populous. And it was an issue last time that there are vulnerable adults with learning disabilities in care homes who do need vaccination.
Yeah, I'm pretty sure the service specification includes any care home resident, not just those in care homes for older adults. But I would need to go away and double check the detail because I haven't memorised that bit. But I'm happy to get back to you, Matt.
Thank you.
Any other questions? Great.
So this is about the 12 to 17-year-olds. That we've got provision at Broad Street Mall, but obviously that's quite a long way for them to get to. And it says investigation about further provision in the localities being looked at. Is there likely to be any provision more locally than that, where they don't have to travel quite so far to get it?
Yeah, so part of that was around the vaccine on offer. So originally just I'll be getting my brand names and my other names mixed up, but the Moderna bivalent, so the one that's recommended for boosters, which was originally available, was only recommended for 18 and above. And now the Pfizer equivalent has been approved, which can be administered to 12 and above. So that vaccine will be coming into the system soon, and will probably become the vaccine of choice. So that should mean that 12 to 17-year-olds have got far more options of where they can go to get a vaccine that's approved for them. But I will double check that the local providers are ordering that vaccine and then making that available to vulnerable 12 to 17-year-olds.
Thank you.
Thank you, Jo. So, Lewis, are you going through the next item for the Wokingham Integrated Partnership update and end of year Better Care Fund reporting?
Absolutely. Thank you very much. So welcome. Thank you very much for allowing me to join you this evening. My name's Lewis Willing. I'm the Head of Health and Social Care Integration. Unfortunately, you've got two back-to-back items from me, one covering the end of last year and the second covering the plan for this coming year. Apologies for the lateness of coming back with the end of year reporting. Unfortunately, due to how we have to hand it into NHS England and an extended period in in the intensive care unit for my youngest child, I haven't been able to join you sooner. However, here I am now, and hopefully you'll be interested to hear what I have to say. So, end of year. Just going to pop the slideshow up now. Here we go. So, our end of year template was requested as a part of our planning. It's submitted on time, signed off by our Wellbeing Board Chair and the lead officer for the ICB. I think the key points to take away from the end of year reporting piece is around our section 75, which is the agreement between ourselves and then the CCG at the council to share our funds appropriately. All of the conditions were met for that, which is good. All of our national conditions were met. Income and expenditure targets were matched. We didn't overspend with our programme, which is always good news. And 2 of our 5 BCF targets were met. So, as a part of our end of year feedback, we have to give, we have some statements from NHS England, which we then agree or disagree with, etc. So the overall delivery of BCF has improved joint working between health and social care in our locality. So we strongly agree with that. The BCF and the Wokingham Integrated Partnership Board, which and the delivery group which we have, and also our Wellbeing Board, there's a key vehicle for us to source funding to support our ongoing work with discharge, emission avoidance, health inequalities, all those key pieces of the BCF and all the key pieces for our communities to stay happy, safe and well, and to enable our work to keep people in the community and independent as long as possible. So we strongly agreed with that. With regards to our BCF schemes implemented as planned, we agreed. The services that we fund did, generally speaking, deliver very well, especially against a backdrop of COVID and the associated complications that there were with a difficult winter last year. But we did very well. And then last but not least is around the piece around whether we delivered our plan. So we strongly agreed with this. So last year, our Wokingham Integrated Partnership, we completed 15 of our 19 projects in the programme, and 3 projects were moved on to business as usual or a secondary phase of that work. So from a pilot to a slightly larger pilot, for instance. Sadly, 1 project did not move to completion last year, and the programme, alongside the operation, monitoring and services that were purchased using home, all very good news. A positive impact on integration, positive impact for our residents locally. So I had to share some successes. So a couple that were highlighted. The BCF supports the purchase of a piece of computer equipment called Connected Care. It's a shared software, something that all of our partners throughout health and social care use. We did note that our colleagues in social care weren't as high users as perhaps some of our other partners around the health and social care system. So we did a piece of education and working with team meetings and everything else to ensure that our social care workers and our social workers were aware of the system, what it could do, what it could achieve, how it could help them in their role. And we did a pretty good job. So we got 100% increase in the number of average users and 100% increase in the number of average uses. It supported better transfers of care from hospital, and also supported better care reviews and better quality of data for our multidisciplinary team meetings, which is always good news, seeing as, again, all of our partners around the table for those. And our second success was around our collaborative reablement project. We had a small pilot last year that supported home care providers to receive reablement training and alongside direct support from occupational therapists to deliver reablement in the community. That allowed us to keep moving people out of hospital, especially in, like I say, in difficult time, but ensuring that we were getting the best possible outcome for them as well. So that project was a success, and we have a slightly larger pilot this year as a result of it. Please excuse me. PowerPoint appears to have frozen. So next up, we have our challenges. So the major challenge that we experienced within our BCF delivery last year and our integration programme, rather unsurprisingly, was COVID. The toll that it took on our health and social care service partners, especially those that are operational, cannot be underestimated, and what a fabulous job they did keeping us all moving and healthy as best they could. Sickness isolation periods took a heavy toll on our workforce, and obviously, organisationally, the operational folks were very busy doing their actual day jobs with increased acuity and volume of people that are being treated overall, and the difficulties that are associated with that. But despite that, like I say, 18 of 19 projects came to a natural conclusion. So I think that's pretty darn good. And then the second one was around empowering users to have a voice, a choice and control. So the one project that didn't actually manage to get finished was linked to getting service user feedback and involving them, understanding their journey through integration. We have very good links for feedback around individual services, but we have limited feedback about the linkages between the services. That project was put on hold as we weren't able to implement it across the west of Berkshire. However, we are looking to pick more of this type of work up this year. So next up, we have our performance piece. And like I said at the beginning, 2 out of 5 of our targets were met, which isn't ideal. But as we've sort of said, it was across a very difficult backdrop. NHS England ensures that we have exceptionally challenging targets, which means that we all work very hard to try and improve our performance. With regard to the first one is around unplanned hospitalisations for a select list of conditions. Whilst we didn't meet the target, we were managed to reduce or maintain our performance at a similar level to the last year, despite COVID, and it worked out as an equivalent of around 0.6 additional attendances a week at the RBH for the people within this cohort. So whilst there is a slight worsening, like I say, less than 1 additional attendance at RBH per week isn't terrible, but we will continue to work with that cohort of people. A lot of work has gone in the background with regards to our ongoing support from our fabulous primary care physicians to provide health checks for those with long-term conditions, support in the communities to optimise their care and treatment with those conditions. The Ageing Well project has been operating well within the community, so well done to the HFT for that. And then some of the schemes that we're running with regards to emission avoidance too, with our voluntary sector highlighted here is keeping in touch. Next up we have is our targets regards 14 and 21 days. We were very close to our predictions here. We were unable to meet those targets, but again, very close. Overall, we remain within 2% of our targets and achieved an annual performance of 8.7, which is better than 9.3, which was our last quote unquote normal year prior to COVID. We had a great deal of support with discharge during COVID with our thing. So we continue to operate several different services in it. So our community enablement project, which we sort of highlighted a moment ago, which supported our work to continue, and the discharge to assess service system was very good as well to support us. Returning people to their usual place of residence was 91%. We hit that target. Fabulous work there. The frequent joint working across the west of Berkshire with all of our different partners, the Rapid Community Discharge Programme meant that we were able to get people back to their own homes and to where possible. The project with regards to right sizing care packages was also effective in minimising or reducing the number of people who had double up care. And then the other one here on this page is around residential admissions to hospital, and that's per 100,000, that's 368. We didn't make our 368 placements. We did manage to hit that target. Again, the hard work from all of our different adult social care and health colleagues to be able to support people to get back to their own homes, and also the reablement process meant that we were able to make fewer placements than our target, which is good. And then the last piece is around 91 days. So 91 days, this is when people have been discharged from hospital, they maintain in the place that they're discharged to within 91 days and not readmitted to hospital. A key challenge for us with this target is that the team that our BHFT team, which deliver this, also deliver end of life support to people. Obviously, we want the most highly skilled community assets to be able to support people to die in their own homes with dignity rather than in hospital. And their inclusion in this reporting has resulted in us achieving 84% of patients being at home. However, it is foreseen that if we remove that, we would be above 90%, which is what our target would be. We have spoken to NHS England about this, but it's unfortunate they're not going to change the way that we measure our targets. Moving swiftly on to talk about some of the fantastic things that we achieved last year. I think the Wokingham Integrated Partnership do a very good job of working innovatively and in new and interesting ways. So with regard to that, we some highlights. We have our Mind Wellbeing service embedded and working towards capacity. They are now at capacity there or thereabouts, which is very good. We had the start and the launch of our Keeping in Touch process, We have population health management profiles for each of our primary care networks. We have a Moving with Confidence service, which is run by our sports and leisure team to support people who have become less able to be independent and move around on their own as a result of isolation and the various lockdowns. We have primary care network social workers, the first place to do this nationally as far as I know, so that we enable better and more close working and support for our clinicians in primary care. As I said, 100% increase in the number and the number of people and the number of uses using our connected care system. We had virtual group clinics for new parents and also for those people that are sadly suffering from long COVID, which have been very successful. Currently, our public health team are writing this up, so well done to Anna and to the PCN in the North that supported us with that. And our Friendship Alliance launched phase 2, which is around our social isolation for people in the community, and that was very successful too. So that's a quick whistle stop of the submission that we made for last year. Have we got questions?
I saw Matt had his hand up and now it's gone down, Matt. So has Lewis answered all your questions?
He has. It's just that the slides weren't showing that. That was all. I was just trying to kind of say. I think they were showing to you, Lewis, but there was something wrong with the screen. But I know people have had them in the pack, so
forgive me.
That's okay. That's okay.
So I was just going to say, well, Lewis, you know, I appreciate that you've been kind of pulling it all together, working with amazing teams. I think it's amazing what we've all achieved in Wokingham. You know, to only be 0.6% up on acute admissions.
Oh, that's not 0.6%. That's 0.6
but,
people. That's
yeah.
0.6 people. So it's not percent.
No, it's amazing because on the ground, you know, there is a lot of acute medicine and lots of sick people going in. So the fact that we've maintained that is absolutely incredible. I also was really pleased with the work that Lewis and his teams were working with our providers the nursing care into their own homes and social care, because whilst we were in COVID, the push from the hospitals was to get people out as quickly as possible. But sometimes if you left them in a few more days, they wouldn't need double up care, they would need single care. That obviously put a lot of stress onto our social care. But with working with the providers who were trained into reducing that, we did some really good work. So thank you very much. And I'm going to hand over to Prue.
I just wanted to say the single most impressive sentence in this is the one that says the Wokingham system did not at any stage use a residential nursing bed for lack of home care. And I think that's a really remarkable achievement. So that's really good news and sign that things are working and making a difference.
Absolutely.
That's down to no small part to our colleagues in commissioning and the providers in our community that work exceptionally hard to deliver that difficult job, especially in such challenging times.
It really does show the strength of the partnership way of working.
Thank you. So Lewis, are you ready for round 2?
Yes, this time hopefully the slides will start moving. Okay, so swiftly on. For those that are used to working in the BCF space, NHS England doesn't always manage to align the planning submission alongside the financial year with which it supports. So this year we were asked to complete our planning submission in July. And we had to hand the final version in on the 26th of September. Just to say that this is a formalised version which we've submitted to the plan, which we developed as a part of our Wokingham Integrated Partnership in May of this year, with the budget agreed for this in June. So this is just a formalisation. We are 6 months into programme delivery and we are working hard. We haven't just sat on our laurels for the 6 months. During the development of this plan, we work with all of the integration team has worked with all of our colleagues around the system, so those from the ICB, BHFT, the hospital, and also with other West of Berkshire local authorities too, where that's been useful for us to work together. Draft version of this was submitted to NHS England to gather feedback and further enhance it. It was welcomed, and the majority of the system, the submission was noted as being good, which is always good news. There have been subsequent issues that have been addressed and with support from our partners. So that's good. So straight out of the gate, the money bit, always a good place to start. So all of our minimum contributions have been met, and our national conditions have as well. And again, like I say, essentially this is a formalised, essentially an agreed version of the one which has already been agreed. You can all read and you've all had the packs, but just as a highlight, so these are some of the sorts of services that we're using our Better Care Fund money for. So as you can see here, a few to sort of pick out which jump out at me straight away is with regards to our START service and intermediate care, so our reablement piece, who we've just given some praise to there, our rapid response and treatment team, care home support team, multidisciplinary team leaders, our mind wellbeing service, our home from hospital service for our colleagues in the voluntary sector there, our friendship alliance as well, working on social care, social isolation, and also some of our interesting things, like I say, like our PCN social workers and our PHM, our population health management analyst. Again, one of the few places, as far as I know, the only place nationally that has one of those as well. And Project Joy, which is our social prescription application. Alongside a rather arduous and very long-winded and quite dull, if I'm honest, if you're not very interested in it like I am, template, we also have a narrative plan to pop in. Essentially, as you can see here, is who's been involved in creating it. The executive summary is a summary of our integration plan for the year, our integration program, which you're going to see in the next slide. Around the governance for local, regional, how it is that we ensure that we do what we do. Obviously, the Wellbeing Board is a big part of that. Our overall approach to integration, how we jointly work, how we jointly commission, how it is that we work with one another, including obviously our Wokingham Integrated Partnership Delivery Group and Leadership Board, and our fabulous work and support that we get from our PCNs. A piece around supported discharge. The BCF is very much focused on discharge, admission avoidance and health inequalities. A piece around our use of the Disabled Facilities Grant and the wider services that then supports. And then a piece around our equality and health inequalities piece there as well. So moving swiftly on to what our programme is for the year. We've got 25 projects at the moment, but you can see there in slightly, I colour coded it a bit. So we've got our 5 key priorities for the year. And again, they closely match our work for the BCF. So we have discharge management support there, minimising health inequalities, a piece around prevention and admission avoidance, a piece there around monitoring and reporting. Obviously, it's very important that we ensure that we do that well. And then a piece around our PCN specific projects that we've got up and running with some of our PCNs locally to support an improvement in some of the specific things and specific concerns and support that we can offer those PCNs. So within our BCF and our programme and our plan, you can see that we don't just support our Wellbeing Board, we don't just support our requirements under the Better Care Fund, but we also support another, as you can see, wide group of priorities within our system. So our priorities nest within those of our other partners. So our Long-Term Conditions Board, Urgent Emergency Care, our Primary Care Board, the Health and Wellbeing Strategy, which is obviously very important here, some work around our NHS planning priorities, our Berkshire West ICP flagship priorities and our ICS service priorities too. So we're working in all of those spaces to not just support ourselves, but to support our partners too, as well as supporting the people in our community, which are the most important. Now, back to targets. NHS England are very keen, and I won't beleaguer this point too greatly. NHS England are very keen for us to keep levels of performance very high, especially as during the pandemic, unplanned hospitalisations and length of stay were very low, generally speaking. And as such, they've pressed us to ensure that we keep these targets low and we keep working to the same level. They won't accept anything other than lower than performance from last year. So overall, we have exceptionally challenging targets. Once again, it's going to take us a few years after COVID for us to be able to, because the way that it works, that they base our targets on previous year's performance, for all of this to settle down. So sadly, we may have exceptionally pressing and challenging targets for years to come. That's no bad thing. We want to keep our levels of performance high. We want to maintain the high standards that we have within our Wokingham system, and continue to push to get the best for our residents. But just bear in mind that we may be they're exceptionally pressing targets, and we may find that challenging to deliver on all of them. And then last up, we have the demand and capacity template. So this is the first time we've been asked to submit this piece of evidence. It's not something that we've ever done before. We had to submit it as completed. However, it wasn't going to be assured this year. So it looks at the demand that we have coming out of our acute hospital and our community hospitals, and the demand in our community, and then the capacity that we have within the systems that support those things. I think there's lots of learning that's been done. There's definitely areas for improvement that have been identified. So we need to change and improve the way that we count and look at things. Currently, on paper, it looks like demand closely matches our capacity. A lot of this is due to the fact that things are measured in a monthly basis on this particular template. So most people don't wait for more than a month to come out of hospital. So it means that we're in, it looks close. So we just need to sort of think about how it is that we complete this sort of thing for next year. And I think we're going to have to change some of the ways that we do our measuring locally to ensure that we get a good snapshot. I think the other piece here as well is that this information is, forms a part of our Berkshire West review of rapid response and reablement, which is and will hopefully improve the capacity of reablement in our community. So the good news is that it's already being used as evidence to support other reviews that are happening around the system. So overall, we've got a pretty robust plan. We've got a very big change plan. So we've gone from 19 projects last year to 25 this year. We're on track with the vast majority of them this year as well. I think I've got earmarked with my team between 7 and 9 to be closed by Christmas. So hopefully we'll be able to keep going and delivering a good agenda for the people of Wokingham. Any questions?
True.
Sorry, it's me again. So I'm not arguing with this, but I just want to understand in the money.
Yes.
You've got nothing put aside into assistive technologies and equipment, and nothing in housing related schemes. And I'm wondering why that they, particularly in assistive technologies, it struck me as something where you would expect some funding to be. So
it's very difficult to represent, obviously, a very big and very diverse budget that covers lots of different areas. So it's my own fault. The piece that I've cut and pasted and delivered onto this particular PowerPoint, it works off of a series of drop-down boxes, and it then sorts them into categories. So we do have assistive technologies. We may not necessarily have marked so you mark the schemes as a primary, secondary, tertiary, what they deliver. So it may well be that we do fund assistive technologies, I promise, but it's to do with whether that was marked as a primary or tertiary or secondary. So it may well be the case that that's then not counted towards that particular total. But yes, we do have those supports for those things. And with regards to that, our disabled facilities grant, the DFG itself, is housing related support in and of itself in a very large way, which I think is over £1 million a year just on its own.
No, I'm very familiar with the DFG. Thank you very much.
So yeah, that's an admin thing rather than a not funding thing.
So Lewis, I'd just like to say something, if that's all right. I'm pleased that although we didn't manage the people feedback from the whole pathway rather than each different service, because I think that's where people fall between the gaps and services may or may not be there. And I think that also feeds into the demand capacity. And I know you need to have numbers and you need to have evidence, but for me, I'd really like to see part of that demand capacity actually having some people's stories about, because you may have 3 people who have got end of life, we've got capacity, but if the 4th person come along, we can't really say if you wait till next month, you'll be all right.
Yes.
So as well as the figures, I think we need a little bit of substance to be able to look back and actually say, is there some commonality or some themes coming out? And do we need to put more emphasis on that rather than the numbers?
So with regard to that particular point, using that as an example, so the wider review which is being carried out off the back of this demand and capacity template, the template itself is it depends on how avant-garde you want to be in terms of how you want to deliver that. It can be quite spacey if you wish it to be, but we've tried to do a unified version, which means that we're able to apples and apples compared to our colleagues. With regards to the point about end of life, as an example, the wider reablement and rapid response review, which is taken part with our colleagues at BHFT and the hospital, does actually look at that. So we're very much clearly trying to understand the rigours of which our intermediate care team, which delivers several services, it delivers a full service, off the top of my head, full service, end of life, reablement, several other things, the rapid response, the Ageing Well 2-day, the Ageing Well 2-hour. This highly crack commando team of healthcare professionals that work in our community do a cracking job. However, there is obviously a limited resource. So with the example there, hopefully I can put your mind at rest. In that particular example, the priority of the end of life care would go in front of a reablement service. The negative thing there would be that then falls to the council, potentially more work falls to the council. However, the person would get the right service from the right people at the right time, so that we would enable that person to be able to have that support. There will be, like I say, in terms of that may result potentially in a small delay at a hospital for discharging someone. So that wider review is going to address those things so that we can understand what it is that we need to do as a system, as a health and social care partnership, to ensure that we're getting the right system, the right people at the right time.
Thank you. And I think just on the back of that as well, where services are unable to deliver is often because there's lack of carers. We have to kind of big up all these carers, because without them, the whole system, to be fair, will just fall down. So absolutely, anything we can do to support them, look at the different ways of working, we really have to do.
And as a side note to that, I know that my colleague Ifti in our commissioning team, Ifkar Ahmed, has carried out and supported our caring agencies to seek employees from overseas, but also supported them with various different programs within our community to advertise and engage further with people to get more people into the caring industry. Alongside, I know that national programs are also taking place. I've seen it on YouTube, and I've certainly seen it on the television. I think Sarah has a question.
Yes.
Hi, so it's not a question, but more I wanted to put on record a thank you and a well done to Lewis, you and the team, for all the work that's gone into both last year and this year's BCF. Your enthusiasm is infectious, and there's a lot of really good examples here of where working together and blurring the boundaries of our organisations really does have good positive outcomes for the people that we serve. So yeah, really well done, and thank you.
We're very lucky to be supported by Andrew over at the ICB, and Belinda, and obviously now yourself. So happy days.
Thank you. So looking forward to the forward programme. I'm not going to go through all of this because it's quite detailed, and we've kind of discussed it before about where we're going to put things in. But it's just a plea really of, we are working together here, and if there's things that we feel we need to be addressing more quickly, then, we're a group of adults, we can discuss which are the higher priorities and whether we need to move things throughout the month so it fits in with all our other different committees and people that need to engage with each other. So I don't know on that whether anybody had some burning desires for different things in different months. A lot of heads in the room. Sarah?
Yeah.
I wondered if we wanted to bring something on the December meeting around further developments and where we've got to with place, and then broader updates on ICP and ICB.
Yeah, that'd be great, thank you.
And we'll take away the point that Matt suggested about the November meeting and how we can use that time to discuss the strategy, which probably will also want to come back to the December meeting as well, actually.
Fabulous, thank you. Anyone else? Sure. Sorry.
Charles,
thank you.
Yeah, don't worry, it's no problem. I was just going to make a suggestion, obviously at Chair's discretion. We've got a COVID update in for December. Obviously, we hope things go well with COVID this winter, but do we need one for February as well?
I think an update to see where we've landed would be probably quite useful. So if we add that to February. Thank you. Fabulous. So any other business? No. Well, on that note, you can have an hour back of your time. So thank you very much for the meeting. Take care.
Thank you.